Diabetes is a disease that can be 100% managed. Having said that, the disease requires constant care, constant maintenance.
There are many serious complications with diabetes, from blindness to heart disease to amputation, so it's natural to feel overwhelmed. But it's important to realize that you are not alone.
Everybody with diabetes can learn how to control their condition, not on their own. They need the support system in place. They need a team.
Number 1, get to know your diabetes team, and they can help you avoid complications.
People want to help you manage your diabetes. That's what we like to do, and we want to help you succeed.
Your healthcare team includes people you are probably already familiar with, your family healthcare provider, and when necessary, a diabetes specialist. But the team also includes your diabetes educator. Some nurses, dietitians, and pharmacists are certified as diabetes educators. They can answer your questions and will be key in helping you find the information and resources you need to manage your condition.
There are no silly questions. You are not supposed to know, but you are supposed to ask. So don't leave any question without asking.
If you haven't met with a diabetes educator, ask your family healthcare provider to refer you to one. Your dietitian. Your dietitian can help you plan a healthy diet that works for you.
We like to build on little successes, and the food part can be very enjoyable. It just depends on your approach to it. There's no suffering involved in a healthy diet.
Your pharmacist. Your pharmacist is an expert in the medications that you are prescribed.
And can I still take that with the metformin?
Absolutely.
They will explain how to take your medicine and any side effects they might have.
We're probably one of the most accessible members of the healthcare team. We're usually here 8 to 12 hours a day, 6 to 7 days a week. So if you have questions, particularly about your medications, you can call or come in and ask us.
Your eye doctor. Your eye doctor will help you manage one of the most serious potential side effects of diabetes, eye damage. Seeing an eye doctor once a year will help you prevent serious complications, like blindness.
What I generally tell my patients that are newly diagnosed with diabetes is that I need them to sit up and pay attention to this. With high blood glucose, what happens is that it weakens, it causes swelling in the blood vessels, and it causes leakage in the vessels. The tissues that have that the fluid leakage don't function as well, and so your vision will be affected.
Your foot specialist. Many people with diabetes have issues with their feet, including thickened toenails, dry or scaling skin, calluses, numbness, and infection. A chiropodist or a podiatrist can be a valuable team member if you find that you are having these kinds of problems. Number 2, take charge of both your health and your healthcare team.
So I say, take charge of those things you can take charge of. Make sure you book appointments when you're supposed to. Make sure that when you go to the drugstore to pick up your medication, stick your arm in the blood pressure machine, get it checked.
Yeah, I started to meter my glucose 4 times a day, get the averages. When I got the appointment with the doctor, I went with the measurements in my hand, so she knew immediately up front what was the severity of the situation.
Number 3, manage your healthcare costs. Medications for diabetes can be expensive, but there are a number of government health plans to help if you can't afford them.
It's going to be $16.85 today.
Okay, thank you.
OHIP covers most drugs if you are over 65. The Trillium Drug Program can help younger people in Ontario with lower incomes. Your healthcare team can help you find the resources you need in your community. Number 4, remember you are not alone. Speak to your diabetes educator or your family healthcare provider to find a peer support group in your community or online.
It's good to know, you have someone else that you can talk to them about diabetes or whatnot. When you go to these support groups, you're talking to people that went through it or whatever, and they have their stories and they're telling you something where you actually relate to them. And you know what? It makes you feel a little bit better. You know that, you can cope with it.
Your healthcare team cares about you and has the information you need to help you lead a longer and healthier life.
The more information, the better information you get, the better are your chances not to have any complication. And without complications, this is nothing so heavy.
right here, right now, we can make your life as productive and as wonderful as you want it to be.